Thank you, Mr. Chairman. As a physician and member of Congress representing medically underserved rural Southern California, I cannot overstate the importance of reliable broadband infrastructure for public health and safety. In rural communities across the Coachella Valley and Imperial Valleys, and in rural San Bernardino County, in my districts, access to emergency care and telehealth can mean the difference between life and death. Many residents, including working families, face barriers to care due to poor internet connectivity. These challenges are worsened by long travel distances, provider shortages, and the recently passed Republican Big Ugly Bill are going to make those worse. Nearly $1 trillion to Medicaid cuts. Hospitals will close, meaning people are going to be more uninsured, needing more specialty care, increased chronic illness. They're going to have to travel longer distances. So it's like we took 10 giant steps back and we're trying to make one tiny step forward with this hearing. And broadband is no longer a luxury. It is essential infrastructure for the common good. Rural residents are at risk for not having good broadband, and not having connection is a risk for chronic illness. In 2019, the FCC found that 17% of rural Americans lack broadband versus only 1% of urban residents. The CDC also links poor internet access to higher rates of chronic conditions and worse health outcomes. Having broadband is a social determinant of health. Broadband is vital for veterans, patient managing chronic diseases, remote monitoring, and seniors relying on remote specialists. It is also important for first responders to respond to emergencies. Sheriff Dicus, from your perspective, how do unreliable broadband and outdated safety networks hinder law enforcement coordination during disasters?
I'm sorry, Dr. Ruiz, a number of things that you said we use regularly. I think you've experienced where you actually have an emergency situation in the field. You're talking to the doctor at the emergency room before you even move the patient. So those things are critically important. Broadband across the rural areas as you're requesting, but it's even something simpler as saving lives. So unfortunately, we deal with a lot of school shootings and things with major county sheriffs, law enforcement really across the nation. If you think about your ability to have that situational awareness, you're going after the threat. You're trying to stop the threat, but there are children that have been shot. Being able to direct your medical emergency personnel into them saves lives. You can't just secure the area. You've got to move. It is a moving, actionable, ongoing event.
Let me ask you another question. Does Needles and Lake Havasu, the area in San Bernardino that I represent, use NG 911?
They are. They're transitioning, and that's a very unique area because of the borders involved, as you well know. And even on the lake, we have multiple jurisdictions as a result of that. So yes, we are using that technology.
Thank you. Because we need to modernize and expand our emergency communication systems, which is why I strongly support the NG Next Generation 911. Our 911 call centers must be able to receive real-time texts, photos, and videos to enhance emergency response and protect both callers and first responders. But this only works if the digital backbone is strong. In my district, we have already seen the consequences of aging infrastructure. Copper wire theft has disrupted 911 service, delaying emergency response and endangering lives. According to the GAO, insufficient broadband infrastructure in rural areas contributes to slower response times as first responders cannot always access critical information in real time. Slower response time in the emergency department means if you're having a stroke, you're more likely to die or have permanent damage. Same thing with cardiac arrest or heart attacks. Dr. Fonce, given your leadership at National Emergency Number Association, what should Congress do to retire old systems and equip public safety answering points, or PSAPs, for NG 911?
Thank you for your question. If I'm looking at public safety writ large, from the field responders to the public who calls 911, the weakest link in this whole chain is Next Generation 911. You talk about broadband capabilities that the public would have available to them, and the ability to transmit information to 911. Well, if that 911 center is not Next Generation 911 capable, or is voice-centric, in other words, rich information is removed, you lose valuable information, valuable time. What Congress can do, and I've said this on multiple occasions,
You have 5 seconds.
is to ensure funding for Next Generation 911.
Thank you. And with that, I yield back my time.